And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Yeah, let's make it a better place. Here on CL 650, we're on Boomer Life, and today we're talking about pain. And a lot of people suffer from pain just because of age. You might have sports-related injuries. It's very common to have aching joints and chronic sort of pain, and you deal with it. People pop pills all the time, and today we're going to talk about an alternative to that, and you don't have to live with the pain. On Boomer Life today, we are joined by Integrative Naturopathic Medical Center in Vancouver, Broadway, and Granville, talking about all the different ways that pain can affect your life, sports injuries, and they have things like regenerative injection therapies and more, and we're going to dive into it. So joining us today is naturopathic physician Dr. Hal Brown, and welcome to the show.
Thanks very much, Zach. Happy to be here.
So tell us a bit about yourself and how you got to become a naturopathic doctor. What was your path?
Well, I was a young man, and I got attracted to going to chiropractic school.
Mm-hmm.
I had some injuries when I was a child, and I had lots of headaches and back pain and neck pain. And
sounds like me.
Yeah,
it's just common too, right?
It's very common. Yeah. Not everybody ends up in chiropractic school, but I did. I went to see my friend's brother-in-law was a chiropractor, and he started treating me, and all of a sudden the headaches went away, and I started to feel like a normal person again. And I said, this is very cool. I want to do this. And then I went to graduate as a chiropractor, practiced for about 10 years or 15 years as a chiropractor, and over that time I developed an interest in nutrition and homeopathy and herbal medicine and natural therapies. And I had the opportunity to go to naturopathic school, and here I am today as a naturopathic doctor.
So can you explain to me, because people don't know the paths that you can get to be a physician and look after people. So how is naturopathic school different from medical school, and what do you learn there, and what kind of qualifications do you come up with at the end versus a doctor?
Well, a naturopathic education is there are schools that are accredited by a national body in the United States.
Mm-hmm.
There's 2 schools in Canada, and I think about 5 schools in the States. I could be corrected on that.
Yep.
They have very strict standards. The basic education, the basic sciences are the same as for medical school: anatomy and physiology, biology, biochemistry. And the difference is in naturopathic school, after going through the basic sciences, then the students are educated in natural therapies.
Mm-hmm.
They're also educated in diagnosis and disease and pathology. So a naturopathic student is going to learn about all the diseases a medical doctor would learn about, except the treatment modalities are going to be different.
Mm-hmm. And quite drastically different in some cases.
Well, drastically different because there's also different paradigm of healing.
Mm-hmm. And we're going to get into healing and what you help people through their pain and to heal, and to even give some regenerative properties to make them feel better for a longer period of time. Because everybody that's listening to this has dealt with pain, either on a short-term or long-term basis. So then you started the medical center. So what happened there? How did you start this this new business that you went into?
Well, we've been together. I have 2 partners, Dr. Larry Chan, Dr. Eric Posen, and we were very like-minded chiropractors.
Mm-hmm. All chiropractors.
We all started as chiropractors as young men, and we shared a lot about our attitude towards practice and a lot of curiosity and interest, and we were all driven to learn, and we just saw commonality between us all. So we just got together, formed a practice of 3 doctors.
Mm-hmm.
And over time, like I said, we all went to naturopathic school together, and we evolved in a similar way. And
so you all went to school at the same time?
We did our naturopathic training together.
Yeah.
Yeah.
Interesting.
Yeah, it's a very interesting kind of process, for sure.
So you're brothers in arms there, as it were.
Absolutely.
Okay, so maybe you can describe what a naturopathic doctor does? Like, what's the philosophy when someone comes in to see you?
Well, I think what we're really trying to do is understand the underlying causes of a patient's or a person's healthcare concerns.
Mhm.
And to get to that, we need to take a really good case history. We really need to hear from the person. Really, what exactly is their story? What led up to the circumstances that led to these conditions? Somebody may come in with a disease,
Mm-hmm.
and it's important to understand that. People may come in with MRIs. That's important to look at those. They may come in with lab. It's very important to look at all those things. But the most important thing is to really listen to what the patient has to say, because very often the clue to solving problems lies there.
Mm-hmm.
Then the next step is doing the physical examination, touching the patient, feeling where it hurts, or understanding what their complaint is. And we may actually recommend lab tests or other tests, or may even recommend MRIs.
Mm-hmm. And so with pain, for example, is it something that you come in and you do a series of visits and they hopefully feel better? Or is it a long-term process? I guess everybody's different, but what's your philosophy on that?
Well, it's the same principle. Somebody's coming in, they have a major complaint.
Mm-hmm.
And whether the complaint is pain or whether the complaint is their digestive system or autoimmune problem or something, I'm still going to listen to their story. I'm going to ask them questions related to all of their health concerns. Now, if the major concern is around a pain issue, then I'm going to find out, when did that begin?
Mm-hmm.
Many people say, well, it just started hurting like 3 weeks ago. I said, but have you had this problem before? Well, yes. When I was playing rugby as a teenager, I had that problem. Oh, okay. Well, let's go back like 20 years now or 30 years to when that original problem happened. Because very often you have to go way upstream for a problem
Mm-hmm.
and start fixing that one before the ones that seem more obvious can get repaired.
So is there a philosophy maybe that you would continue to see your naturopathic doctor just for general well-being over a long period of time? What do you try to say to your patients?
Well, I think everybody has different interests in how to manage their health.
Mm-hmm.
I think that having a relationship with a naturopathic doctor is really important. I think depending on what your concerns are, some problems may take a long time to resolve.
Mm-hmm.
Other things are very quick and easy to deal with.
Mm-hmm.
So, I mean, every single situation is different. But I think every naturopathic doctor accepts that, when somebody comes to see them, they're there to be the physician for that person forever.
Yeah. Well, you want a relationship that you're going to have
That's
for a long
right.
period of time.
So we're available.
All right. Now, the one main one is people are trying to avoid using synthetic drugs, and they want a more natural. And we're seeing that in society generally. People are looking for organic food. They're looking for naturally sourced products of any kind. We have somebody on here who's in the sleep business, and a lot of people are trying natural fibers in their bed, for example. So we're seeing that trend in society anyway. And so you must have patients come in to see you because they're trying to avoid getting onto the blood pressure pills or something like that, right?
Well, I think there's a difference between saying I don't want to take synthetic medications and saying I want to understand what the underlying causes of my health problem are.
Mm-hmm.
I mean, I have people come in and say, well, I never see doctors. Well, you're seeing one now.
Mm-hmm.
Well, the synthetic drugs have a purpose. Okay, so the real question is, what's the best treatment for your problem?
Mm-hmm.
I mean, if you come down with a very serious pneumonia and you're barely on life support, I think you're probably going to want to take that synthetic antibiotic.
Absolutely.
Okay, so the point is really...
here are your options. You're not going to make it, or you're going to make it.
That's right. There you go. So I think the real question is, do you really want to resolve the underlying causes?
Yeah, absolutely. And we're going to get into pain because that's what we wanted to get a little bit of a background on yourself and your philosophies on running your practice and your working with your patients. But after the break, we're going to get into talking about pain management programs. when you see patients with suffering from pain, people who have had car accidents, and there's all kinds of reasons why people might want to visit you. We'll continue the conversation. We have Dr. Hal Brown here joining us from Integrative Naturopathic Medical Center in Vancouver, and we'll continue the conversation next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.